And now the Ministry of Health is warning health systems may be overrun as the number of COVID-19 cases continues to spike. In the latest update, Health Cabinet Secretary Mutahi Kagwe has asked county governments to strengthen their capacity to admit COVID-19 patients. This comes as the number of COVID-19 cases increased after 724 people tested positive for the virus, while 14 others have died in the last 24 hours, bringing the death toll to 1,027. Michael Mwadigah with the latest data by the Ministry of Health.
Health CS Mutahi Kagwe was in Malindi, Kilifi County, which is ranked at number 11 among counties worst affected by the coronavirus pandemic. It is here that he revealed the health systems are overstretched, warning counties against failing to boost their capabilities to handle COVID-19 cases.
It is citizen responsibility that can really help us in the containment measures that we are going to make. It is going to call for sacrifices once again. Sacrifices we can ill afford. But unfortunately, it is also sacrifices we have to make if we are going to save lives. We cannot afford to continue on this trend of 100 lives in 1 week as a result of COVID-19.
Kagwe warned with a positivity rate of 14.2%, there was need for the counties to make more sacrifices and equip health facilities and health workers in order to save lives.
I continue to urge the county governments to emulate what those who have invested in isolation beds, those who have invested in ICU beds, in HDU beds, to do so very quickly. Because it is very clear there will be no movement of patients from one county to another on grounds that if it escalates, if the virus continues to hit us in the manner that it is, it means that each county will have to take care of its own patients.
At the same time, he urged Kenyans to prepare for home-based care programs and the local administration, including law enforcers, to ensure COVID-19 burial protocols are followed forthwith.
We need to be prepared. Discuss it. I urge you to discuss it in homes and to ask yourselves how to manage yourself. If you live on your own, then you need to discuss with somebody that in the event that you become positive, you might have to stay in your home, but somebody else might have to visit you within the protocols that we have said. So, fellow Kenyans, this is just to say that this disease is with us as a community.
With Malindi being a tourist hub, Kagwe noted that the county government of Kilifi is partnering with the Italian government to open a private health wing with the state-of-the-art equipment, which will attend to visitors instead of being airlifted to other areas to receive medication.
Kilifi is one of the areas where serious research in Kemri is going on. Is one of the areas also we are training our people in research and therefore can be able to collaborate in the research area.
This comes as the country recorded 724 new positive cases from a sample size of 5,085 tests. The youngest patient is 1 year old and the oldest is 90 years old. 50 patients are on oxygen, 55 patients on supplementary oxygen, and 54 patients admitted in the ICU, while 10 are in the high dependence unit. A total of 248 patients have recovered from the disease, of which 178 are from the home-based care program. Reporting for Channel 1 News from Malindi in Kilifi County, I'm Michael Mwadigah.